Welcome to the Trial Site News Roundup. Today on our episode, we'll be discussing Dr. Fauci, who appears now to be outselling the idea of early oral treatments. About a year and a half late, it would seem. The pitch appears to be seeking to monetize the majority of COVID-19 cases. We'll talk about what is going on here. And then we'll be talking about a disturbing move by the Federation of State Medical Boards, which appears to be taking steps to silence doctors by threatening risk of pulling licenses for what they call misinformation. And so, from Trial Site News, I'm Adrian, and our episode starts now. So, Dr. Anthony Fauci appears to be pivoting his focus and is seemingly in sales mode, now representing his pharmaceutical patrons. After spending many billions of dollars already on what in many cases have become throwaway monoclonal antibodies and several questionable therapies in the pipeline, the head of the National Institute of Allergy and Infectious Diseases, or the NIAID, and chief medical advisor to the President of the United States, has spent lots of time minimizing the mounting evidence associated with many generic early COVID-19 treatment options, from Fluvoxamine, Ivermectin, and who could forget, of course, Hydroxychloroquine used in select scenarios. Now, Dr. Fauci is now floating the idea of wanting to deliver to the market the perfect pill, which would help the industry monetize the massive market for early-onset COVID-19 mild to moderate cases, which happens to be 90% of total cases that fall into that category. Now, Reuters recently showcased some of Dr. Fauci's latest pitches, including the ability to care for individuals early, stopping the virus from progressing to an upper airway infection, thus turning the virus into what is more like a common cold. Here, let's take a look at a clip from the Reuters YouTube channel with Dr. Fauci.
We're looking at an orally administered, maybe 7 to 10 days, given to person who is early on in the course of their infection before you get to the cascade of events that lead to the aberrant activation inflammatory response that kills people.
Now, in the video, which of course we will link to in the description below, he goes on to suggest that his perfect pill is one that blocks a specific viral function, is taken once a day, and is low in toxicity with minimal drug-drug interactions, and should be orally administered and given for 7 to 10 days. Now, this then begs the question, do you think Dr. Fauci would be open to generic options such as ivermectin? Time, of course, will tell. And so, with Dr. Fauci pivoting, he now begins to focus less on vaccines and on to early treatments, something that should have been part of the focus a year and a half ago. For our second story, a disturbing move is underway, with the stakes against purported misinformation getting even more controversial as the Federation of State Medical Boards Board of Directors releasing a statement declaring that physicians and other healthcare professionals involved in the dissemination of COVID-19 vaccine misinformation and disinformation via social media platforms, online, and in the media potentially face grave actions, including the loss of their medical license. The FSMB put out in their statement saying that physicians who generate and spread COVID-19 vaccine misinformation or disinformation are risking disciplinary action by state medical boards, including the suspension or revocation of their medical license. Due to their specialized knowledge and training, licensed physicians possess a high degree of public trust and therefore have a powerful platform in society, whether they recognize it or not. They also have an ethical and professional responsibility to practice medicine in the best interest of their patients. They must share factual, scientifically grounded, and consensus-driven information for the betterment of public health. Spreading inaccurate COVID-19 vaccine information contradicts that responsibility, threatens to erode public trust in the medical profession further, and puts all patients at risk. So who is the Federation of State Medical Boards? Well, the Federation of State Medical Boards, or the FSMB, is a national nonprofit organization representing the medical boards within the United States and its territories that license and discipline allopathic and osteopathic physicians and, in some jurisdictions, other healthcare professionals. The FSMB serves as the voice for state medical boards, supporting them through education, assessment, research, and advocacy while providing services and initiatives that promote patient health, patient safety, quality health care, and regulatory best practices. So then the next question is, what is misinformation? As we here at Trial Site News have discovered, the quest to determine what is, in fact, misinformation may vary depending on the interests behind the interpretation. For example, Trial Site News has been censored by social media for simply reporting on ivermectin studies, or reporting when a nation, such as Slovakia, accepted the use of ivermectin in that country. That was deemed misinformation by Facebook, even though it was 100% factual. Consequently, this latest news serves as a cautionary tale to physicians and healthcare professionals that the prospect for intensifying censorship activity is a real and tangible threat to doctors and healthcare professionals. A disturbing trend that is continuing to gain momentum here in the age of COVID-19. Now, for more information about how state medical boards and the FSMB respond to the COVID-19 pandemic, you can visit the FSMB's website at fsmb.org. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining me on the program today. From Trial Site News, I'm Adrian, and I will see you all next time.